Welcome back to the Exam Room podcast. We are continuing our conversation with care manager and RN Pamela Knowlton. In our first two episodes, Pamela shared why meaningful relationships are essential to quality healthcare and how proactive, patient-centered care can improve outcomes long before patients become high risk. Together, we explored why prevention begins with trust and why meeting patients where they are may be one of the most valuable investments healthcare can make. In part 3, the conversation turns to one of healthcare's greatest challenges: clinician burnout, increasing workloads, and the growing role of artificial intelligence. Can technology help improve care without replacing the human connection patients need most?
I'm sitting here chatting with Pamela Knowlton, and we're talking about relationship and rapport building and human-centered care, which is not a new topic. But this puts more pressure back on the healthcare professionals and providers, right? We're tasked with doing more with less. We have less resources, we have less staff, we have less time. So burnout is a thing, right? Burnout, time pressure, increasingly demanding workloads. That is impacting clinicians and patients, right? On both sides of this relationship. This isn't a secret. What are your thoughts about how burnout, time pressure, increasing demanding workloads, how is that affecting patient care?
Well, it's giving patients less providers, for one thing, because doctors are leaving healthcare, nurses are leaving healthcare. Patients have less choices in who they see and in how they interact because everything it's becoming automated to save time, to save people, to save. It's, again, it is a system, but that system is made up of people. And when you are burdening the people who are trying to give personal care in whatever capacity, floor nursing, doctor's office, home health, case management, they're being metric driven, not patient driven. And it's all about how much they can save or how much they can make. What's the profit line? It's a business. It's not healthcare. At least that's how I feel about it. I want to go back to like a nursing home where you have, on a good place, 22 patients to one nurse. What kind of care are those 22 patients getting from that one nurse and maybe two techs? Add in all of the issues that some of the elderly have with cognition, with behavioral, and you've got people that are trying to do the best they can with very little. Their voices don't feel heard. Is the money worth that? And I can honestly say I walked away because the money is not worth that. It's the people that matter. It's providing good care, not pushing pills at people so that their behaviors are controlled. It's not sometimes over medicating them because that's the easier thing to do rather than to pay attention. I don't have answers, but I have observations and I have a heart that wants to do what is right. And there are a lot of us out there who are walking away because they can't, because the system prevents them from doing what is right.
So we're talking about a very systems-based approach, a very automated approach, or automating some parts of healthcare. And it made me think about this show, a documentary that I saw a long time ago. You might have seen it, called Code Orange. I hope I don't misspeak. UCLA that developed the first emergency medicine program. And it was physicians talking about emergency room physicians talking about when that program kind of first started and emergency medicine was the thing. And the takeaway for me was that they could do whatever they needed to do to take care of their patient. You didn't have to stop and fill out a form. You didn't have to check this or check that box. It was, I'm the physician with all of my training and my expertise. I feel patient needs X, patient got X. That was kind of that was the gist of it.
Right.
And now, fast forward all of these years, and there is so many processes and so much red tape, let's say, on both sides of the relationship that I can't imagine how frustrating it would be to know my patient needs this. And because of the system being the way that it is, I can't give that to them.
Right.
You know,
Yeah.
I, I worked, like I said, in surgery for a lot of years, and one of the uh, ophthalmologists I work with, she had a patient who had, uh, I think it's called ectropion, where the eye, or no, entropion, where the eyelid rolls in, the bottom eyelid rolls inwards. And Botox injections helped with that, but insurance would not pay for her patient
Mhm.
to have it. And she said, I could not, in good conscience, not give my patient those treatments. So I just had her come in. I gave her the treatments. I didn't charge her for it because she couldn't afford to pay the hundreds of dollars that it cost for the Botox injections. But I did it anyway. Something is broken, and it's frustrating on both sides of the line.
So I worked with a primary care physician in a different state. The population, it was a high diabetes population. And there was one patient in particular that we saved samples for
Mm,
because she could not afford her insulin. And I was doing case management, and the doc was like, yep, you do whatever you can do. We've got drug reps coming in here trying to push all kinds of stuff. Let's see what we can get. So you develop a relationship with the drug rep who has
mm,
access to all of those samples that that patient needs. Am I gaming the system? Probably, but it was the right thing to do. I feel like it's profit above patience is what it
mm.
has turned into. And that's sad.
It definitely, we've been forced into a more transactional
Mhm.
system. Again, that's why I love this idea of value-based care. I want all healthcare professionals to embrace the idea of value-based care, and I think they do. It makes sense.
Yeah.
It makes sense. It's just difficult to implement,
Mhm.
on so many different levels. Before we leave this topic of burnout and time pressure and demanding workloads, what are your thoughts about AI and how it is? Do you have any opinions about that and how it's kind of fitting into these nooks and crannies of our healthcare system?
I am very hesitant about AI. I can understand where there would be some positive benefits to it. But again, you're replacing that human touch with yet another system. I see it happening in like EMRs where people are being told, we want you to use AI more. And actually, when I was at a funeral last week, I was talking to a young man who went to work for one company that developed EMRs that was bought out by another company where 10,000 people, when that company was bought out, did not go because they eliminated the jobs. And they have
Mm,
metrics where they are being told, yeah, we want you to utilize AI better. It will help with less errors. It'll help with a lot of things. But again, you're dealing with people. How do you replace that human touch, that human emotion, that human investment and relationship with artificial intelligence?
Mm.
So I think that it is a slippery slope. And I am very, very cautious about how it would be utilized, because there are a lot of things that when they came out, with metrics and with all kinds of other things where you're like, oh, yeah, okay, I can see where that would have some benefit. And now we are fighting against it, trying to put the human back into the system.
Yes, gosh, I do hope that we don't do that. My hope would be that AI could be used as a tool to improve quality outcomes for
Mhm.
patients, but not widen the divide, between us. I can see it as a useful bridge. I hope it just
Mhm.
doesn't get us farther from that human, real human centered care that we've been talking about. I agree it can be a slippery slope. I agree that it can also help us see things more quickly.
Mhm.
I was 100% against AI when I met with my friend. This has been years ago. And she's like, "Oh," she works in education for the city of Phoenix, and she's like, "Oh, have you been using AI? I've been using it to develop some of my curriculums." And I was like, "Eek,
Mhm.
no!" And then Cengage, a little plug here, they had like this 2-day workshop, virtual workshop that was all about AI and how it could be levered in higher education. And I didn't completely walk away on day 2, like with my pom poms, doing my cheer about AI, but I did walk away with a, a better understanding of how
Mhm.
I could leverage it as a tool. But one of my biggest takeaways was um, something got said about when using AI, we still need to use it human, AI, human. Like there needs to be a human on either side of that. And that's something that I want us to keep in mind as we move forward. Any of us using AI, that um, you know, there needs to be a human on either side of that process.
Agree. Absolutely agree. But I don't want to be a pessimist. I consider myself more of a realist, because it just seems like that pendulum never swings center.
Mm, hmm.
And I think that we need to be very much aware of the fact that that pendulum can swing to the point where, again, that human is taken out of it.
Yes, agreed. Agreed. We need to leave the human in there.
Absolutely.
More human.
Yay!
Thank you for listening to The Exam Room. In the final episode of this special 4-part series, we'll move from identifying challenges to exploring solutions. Together, we'll discuss practical ways healthcare organizations can bridge the communication gap between providers and patients, strengthen therapeutic relationships, and build care teams that support the whole person. We'll also hear Pamela's message to healthcare leaders and the one thing that continues to give her hope for the future of healthcare.